Canadian Association of Veterinary Cannabinoid. Do I have that? Close enough. Medicine. Dr. Ian Sandler, veterinarian, Grey Wolf Health, Animal Health, and Darcy Bomford, CEO, True Leaf Pet. Got that right? Fantastic. Before we start, Sarah, I gotta ask you though, I never really thought about pets and cannabis. How does it go hand in hand? How does it work?
Animals have the same receptors and the same endocannabinoid system, or relatively the same system that humans have. So the benefits that we see with cannabinoids and cannabis-based therapy in humans is expected to be quite similar to what we see with pets. And so far the research that's coming out very slowly is showing that to be the case. So.
Wow. Well, this is going to be really interesting. Big round of applause for our panel, and let's get this going.
So hi everyone, thanks so much for coming. I'm Dr. Sarah Silcox. I am one of the founding directors and the president of the Canadian Association of Veterinary Cannabinoid Medicine. And just to give you a little heads up as to sort of where we came from, around this time last year when I was asked to speak on cannabis for pets, it became clearly evident that there was this need for a group of professionals to step up and really advocate to ensure that our patients can have the same access to this emerging medicine as our human family members do, as well as the need for education, both for the public as well as the veterinary profession. Much like human medical doctors, we're really at a disadvantage in that we don't get the opportunity to learn about the endocannabinoid system and cannabis as a medicine in veterinary school. So we're really hoping to push that agenda forward and really excited about what the future holds. Ian, do you want to share a little bit about where you're coming from?
For sure. So thank you everyone for coming today. This is a topic that's near and dear to my heart. The reality is both Sarah and I come from the medical side of this. So we are practitioners. We are in the trenches, if you will, every day. We see tens of thousands of animals. I've been practicing for over 25 years now, and we see anything from behavior issues to pain, illness such as cancers, the list goes on and on. So when you look at sort of the therapeutic areas where cannabis is certainly showing to have some potential benefit on the human side, there's no reason that there shouldn't be that benefit on the side of our pets. So we'll certainly share with you some strategies and ideas in terms of where we think this market is going to go.
Thanks, Ian. I'd love to know how many pet lovers are out there. Who has a dog?
Yes.
All right.
Is that one hand or two hands?
Yeah, I do it. My background actually is 30 years in the pet industry. I had a company that manufactured natural products for pets, and I exited in 2012. And I was an early applicant in Canada's medicinal cannabis system, and we soon got sidelined. We're in the queue waiting for a license. So a year and a half into it, we launched a line of pet supplements based on hemp for pets. So we've been marketing our hemp products for pets in Canada, the US, and Europe now since 2016.
Fantastic. Just sort of to get you guys prepared, we are very open to questions. We really want to involve you guys as much as possible. So I'd encourage you to start thinking of any questions that you might have. And at any point during the talk, if you do have questions, just pop your hand up and someone can come out with a mic and get that on your way. I think maybe one of the things we can talk about is hemp as a food and hemp as sort of the nutritional benefits, and then breaking things down into CBD versus THC and the other cannabinoids and terpenes that we can find in cannabis. Darcy, do you maybe want to share a little bit about some of the benefits that you found using strictly the hemp seed and hemp flower in your line of products?
Yeah, for sure. So we use primarily hemp seed, so hemp seed oil, hemp seed protein, the same kind of product that you find in your health food store or in the US in Whole Foods. And primarily did that because we wanted to have a product line that was 100% legal across North America. But hemp seed by itself has some, very beneficial ingredients. The oil is very rich in omega-3. It has a perfect balance of omega-3 to omega-6. It also has some other unique ingredients: gamma-linoleic acid, stearidonic acid, ALA, and some of these ingredients are proving to have a beneficial effect for inflammation and hypertension. And so that our initial product line is actually hemp seed based. We do not have CBD currently in our product line, but we are looking at securing strains of hemp so that we can extract our own CBD in the future.
Awesome. And I think one of the questions that I get asked most frequently through the association is, why are we so focused on CBD when it comes to pet products versus CBD and THC? Which is better? Should I use just a CBD product, like a CBD isolate? Should I use a whole hemp product? And I think my answer to that is always there's a place for everything, and there are pros and cons to different types of products. And I think in the emerging market, we're likely to see a range of different products, from CBD only to products that will likely fall more under the prescription or doctor supervised therapies with low levels or moderate levels of THC in there. Certainly, I think there's been a lot of focus on CBD simply because that seemed to be the easiest access to market south of the border, where CBD, although it sort of sits in this legal gray zone in the U.S., depending on if you're talking to the DEA or the hemp farmers, but CBD is used a lot more. So we've had a lot more studies using CBD, and when I say a lot, it's a handful, and certainly a lot more just pet owner experience using CBD products that have been available. Ian, do you want to maybe talk a little bit about bringing THC into the mix as well?
And I think Sarah raises a really important point. So in many ways, the animal health market in Canada is probably where the human cannabis market was 5, 6, 7 years ago from a regulatory perspective. And so what we're certainly seeing, which is kind of interesting, is the shift towards where veterinarians stand, if you will, from a prescribing point of view. So currently, as a licensed veterinarian in the province of Ontario or any other province in Canada or territory, we can prescribe any animal labeled or human labeled product that we feel is appropriate for that particular ailment that pet may have. So for example, is if your dog or cat is in significant pain, we can prescribe all sorts of controlled substances. So many of the opiates that we know that are used on the human side, obviously abuse and misuse on the human side is a big issue, which is really helping in many ways the promotion, if you will, of cannabis-based alternatives on the human side. But we as practitioners can prescribe anything, but what we cannot currently prescribe is cannabis-based products. And what's interesting for me as a practitioner is that our patients can't speak to us. So much of what we do is titrate and use various lotions and potions, if you will, to help alleviate primarily pain. But if it's anxiety, if it's a behavior issue, if it's a neurological issue, it could be really a gamut of issues. And so for us to have another tool in our tool chest that potentially can aid in these various therapeutic classes, I think is massive. And so certainly as you see the bill being presented and hopefully moving into full legal status, if you will, from a law perspective, I think you are going to see a pathway changing for us to then be able to start looking at these products. Coming back to Sarah's point around CBD and THC, we certainly have a pretty clear idea around safety levels on the CBD side, and I think we have some pretty clear ideas of where things sit on the THC side too. What we are seeing is, if you will, a lack of public awareness on these products in general. So we know in Canada there's over, close to 300,000 medicinal unit users that are registered with
registered users, exactly.
Registered users with LPs that are accessing these products through a legal channel. We know that these are very potent oils and buds and combination products that are sitting now in homes that maybe weren't as exposed before. And so what we want to make sure is that animals do not have very clear access, if you will, to very potent human products. I think that this is a key factor. So when we hear of increased ingestions on the animal health side, it's a reality. Still, the number one product or the number one reason dogs and cats come into emergency clinics for inappropriate ingestion of quote-unquote toxins is because they got into their parents' prescription drugs. That could be Tylenol, that could be painkillers, that could be behavior medications, the list goes on and on. So the reality is there needs to be an education process, and I think we as veterinarians and as industry members moving towards the use of CBD and THC-based products really have a role in that. Now, stepping back sort of further, where I think veterinarians and the colleges really play a role is that the reality is pet parents are asking for these products. They're saying, hey, if there's a safe alternative to using a prescription medication, if my pet has the potential to have some therapeutic relief without potentially engaging in a lot of the side effects that they may have using a prescription medication, what is the pathway for us to use these medications? And again, I think hemp products play an important role, and we can't underemphasize the role of omega-3s and omega-6 in inflammation. So you hear about arthritis treatments, brain elasticity, if you will, and we think about cognitive function, and the list goes on and on, upregulation of good things within our immune system. So really on the CBD side, I think it's going to be a quicker pathway to see the CBD-based products come into the marketplace. I think that the catch with the THC is you're going to have to start with a very, very low concentrate and move out. So any of these products that we're talking about, because remember, similar to on the human side, what we will see on the veterinary side is that oftentimes the carriers for the oil is a medium chain triglyceride, which is essentially a fatty chain oil. And so these products can cause some stomach upset with your dog and cat if you're starting to use them. And certainly when we get into horses and animals like that, it's a whole other thing. But I think when we start looking at these products, we're looking at more testing, more studies, and we're seeing Canadian centers starting to engage. We as a company are looking towards moving in this direction, and our partnership with CanTrust, we feel, is really an excellent way of doing that.
Yeah, I think you touched on several good points there, Ian. I want to sort of circle back and talk about a few of those. You had mentioned what do pet owners do if they want to start incorporating these treatments into their pet's therapy. And the first thing I would say is talk to your veterinarian. I admit that there are a lot of veterinarians that may close the door on that conversation. And again, I think that comes back to a lot of professional education. Because we really don't have a legal pathway to prescribe and recommend these products, and there really aren't any veterinary approved products from Health Canada at this point, we do have to tread really carefully because our regulatory bodies have cautioned most veterinarians about making outright recommendations for using cannabis-based products. That being said, it doesn't mean we can't talk to you about what we do know, what we don't know, what studies are available. And if your veterinarian doesn't know what studies are available or know the potential risks and benefits, I would really encourage you to help educate them, steer them in the direction of the Canadian Association of Veterinary Cannabinoid Medicine. Have them start Googling some research and getting that information out there, because we do have studies. We do know about THC toxicity. We know levels that are likely to produce adverse side effects. I almost hate the word toxicity because toxicity to me sounds more like a poison, and any drug can have side effects, and that's really what we see more than toxicity, I would say, are adverse side effects. If your dog happens to consume some THC and becomes a little sedate, is that toxicity? Or, maybe it's only toxicity when we run into problems regulating bodily functions, heart rate, body temperature, that sort of thing. So education is the key. Talking to your veterinarian, and even if your veterinarian is not in agreement with your choice of treatments, it's important that they know what you're doing, because there can be some potential drug interactions, and we need to know that. And more so, if you're using a cannabis-based product for your pet, and your pet's doing amazingly well, let them know that too, because that will help open their mind and open their opportunities for learning so that other pets can benefit as well.
And where I think it's a really interesting time to be in Canada as a licensed veterinarian is our national licensing body, or if you will, our national advocacy group, the Canadian Veterinary Medical Association, is very pro veterinarians' abilities to prescribe these products. So we may still be a minority in terms of a number of veterinarians that are actively looking at where these products will come into our channels and how we can utilize the use of these products to really help pets. But the reality is, from a national level, And if you look on the human side, there's not necessarily that buy-in from the top levels on the human MD side. There's still a lot of discussion around, where are these products going to fit into the marketplace? How are you going to control their use in young children, et cetera, et cetera? And the reality is, for me, I see, high CBD and THC, either individual or combo products, in the animal health market as a medicinal line. So I really see these as a medicinal play, if you will, because I think it's important that if you're going to start using these products, it's not for the rec market. You're using them to address a specific therapeutic area. Now, obviously, on the hemp side, there may be some benefit from a disease process, but oftentimes these are wellness-based products. And again, I think they're very important and they should be in the market. And again, I commend Darcy for really providing those products very early into the marketplace. I think it's amazing that pet owners have access to these products and understanding the difference in how these products work. But the reality is, when we start looking at these products, we really need to look at why are we using them, what is our goal at the end of the day, and how do we interact as veterinarians with patients and if you will, pet parents, to really understand what kind of needs you're looking for.
Darcy, can you maybe speak a little bit on CBD-only products? So products that contain minimal to no THC, but the therapeutic benefits of CBD and where you envision those being sort of placed within the market in the coming year or two. Once CBD is currently a controlled substance, so with the incoming Cannabis Act, that's going to fall out of the scheduled drug list. Where do you see that playing? I know I've had my own conversations with Health Canada, and I think I've got a bruise on my forehead to prove it, but where do you see that coming?
Yeah, our existing line is a supplement line, so we try to have as standardized formulas as possible with references, of course. And it would be a phase 1 product for dogs and pets that have minor issues. But we see CBD coming in as sort of the next product line, higher strength formulations. And then possibly phase 3 would be a veterinary line that would be even stronger, right? So in terms of CBD, ourselves as a company, we're looking now to secure the right strains or cultivars of hemp or cannabis, and that have the correct amount of CBD, the right terpene profiles. We hope to extract our own CBD and our own terpenes, and then reincorporate them into a standardized therapeutic product, right? So we really see it as close to an animal drug as possible without having to go through the process of a new animal drug approval, which I think is probably where Ian is heading down, right? So.
And I think to Darcy's point, the reason these products are moving along so quickly, if you will, from a market perspective, is our government has really put this as priority 1 from a legalization perspective. And so where Canada is very unique, unlike the U.S., and of course there's some European markets that are similar, but we're really talking a national basis, is the medicinal market was launched here first. And so I think that's actually put us in excellent standing with Health Canada in terms of having the discussions around how do we get these products to market quickly, and what is the appropriate testing that fits within the legislative boundaries, if you will, in terms of where these products fit, because you're really looking, after the legislation is passed, you're looking at a whole new class of product. Similar to what happened with alcohol and tobacco, cannabis is going to sit within its own little silo. And again, I think that's a good thing from the public use perspective. But again, from the animal health perspective, I think that allows us to really try and get some trials done very quickly at looking at how these products are going to affect various illness states.
Yeah, for sure. I think they're coming.
I'm a little bit curious. I saw a whole lot of hands go up when Darcy asked if we had any pet lovers in the audience. Given that we're at a cannabis conference, how many of you pet lovers have ever used any cannabis or hemp-based products for your pets? All right. And can you leave your hands up if you've used products with THC or if you've used CBD only?
All of the above.
Very cool.
From what I've seen, THC and CBD together is a very effective cancer treatment, right? That's usually where I've seen THC used.
Yeah, I agree, and I've had several clients, and one of the reasons I kind of fell into this area is a big portion of my private clinical practice is dealing with hospice and palliative patients. So I tend to get a lot of cancer and end-stage illnesses, elderly pets, where, quite frankly, a lot of the conventional medicines that we have simply aren't tolerated well, or they're just not sufficient on their own to manage the condition that they're dealing with. And so what pet owners are really looking for is something else that they can use to help improve that quality of life. And I've seen the same thing. I've seen positive response with people using CBD only. I've seen positive results with people using sort of their own medical cannabis that they've selected to divert to their pets that has that low level THC. And I've actually seen some patients with advanced cancer using high concentrate THC products that have just been titrated up. Start low, go slow is the motto, and that's what we've done, and there have been some really positive benefits. So I think it'll be really exciting. You had been talking a little bit about choosing the correct strain and terpenes, and I think that's something that's overlooked. There's so much focus on CBD and THC and what are the doses that we should use, but I think that the next few years are going to be really exciting, looking at, are there particular strains and ratios of cannabinoids? Some of the minor cannabinoids like THCV or the acidic forms as well are really exciting.
In the most simplistic way, I sort of see this area just exploding, not only in different delivery methods, treats, snacks, the list goes on, and clearly, you can see through Darcy's company that there's a need for that, and there's a want from the pet owner's perspective to have these products available. But, as you're mentioning, 60 years ago, if you had pain, maybe ASA, so aspirin was really your only option. If you look at the shelf under painkillers, just on the over-the-counter ones, I mean, there's hundreds of them, and then if you go into the prescription ones, it's even greater. If you look at the top 3 ailments in our world, it's pain and it's behavior.
Yeah.
So the number one reason that animals are either euthanized or given up for adoption is that they have not fit into their pet parents' lifestyle, and that's just the reality of where we are. Sometimes people can't afford dog walkers, sometimes people can't get home from work to take them. Sometimes these pets are more destructive. Sometimes there's aggressive behaviors with other dogs and kids. And so the reality is, if we can help these animals stay within homes, there's a perfect example of just one area where we can really increase, the ability for the pet and their household, if you will, to coexist together. And I think when we start looking at these products above and beyond what's on the market already, so take prescription drugs, take some over-the-counter products, what I call, vitamin-like supplements. If you look at THC, CBD, and combination products to address some of these issues, the reality is it's very, very exciting for us as practitioners to give you folks some tools and some guidance around where we can go.
I'm watching the little countdown clock here. We've got a few minutes left. Are there any questions from the audience? Do we have a mic for the audience at all?
Do we have a mic?
Yeah.
Oh, it's right there.
Perfect.
Hi, first of all, I'd like to thank you for being here. My name's Al Rappern from the 420 Radio Show. We're actually live right now on the air. I was so enamored by you guys coming that I had to come and listen. My dog 10 years ago got cancer, had hanging things, bad teeth. I put him on full RSO for a little while, and I got 3 years out of him.
Awesome.
He's gone now, but I have a dog that has some temper issues, and I'm thinking about trying the CBD with her. Are you folks looking at temper issues and helping with training? Is cannabis going to be a help with that, do you think?
I think, do you mind if I jump in here? I don't think anyone's looked at specific research towards things like anxiety, because when we're doing clinical research studies, oftentimes they want something measurable.
Yeah.
And so anxiety in a pet can be really hard to measure. What we do know is when we survey pet owners and say, what are you using these CBD products for? Anxiety and behavioral issues rate really high. And it also rates very high in terms of the positive response seen as well. And so if you have anxiety type driven behavior or fear-based behavior, I certainly think that a CBD product could be beneficial in helping your pet get through that so that training becomes more effective.
I know you can't hear me, but I've also found that stems are very good.
The stems.
Yeah, they chew on them.
Right, and calming is our number one seller by far in the entire product line too.
There you go.
Yeah.
It's really amazing.
And a couple of notes to that. I think what you're going to see is what we're looking for, and why for us Can't Trust was the partner of choice, is consistency, the quality of the ingredients, GMP, or what they call good manufacturing practices. So it's the consistency and the reproducibility, if you will, of that product and how it'll work with your particular pet.
Yeah.
I think what you will also see is you'll see some smaller clinical studies set up. So you'll see real-time studies. For example, we have engaged, and we will be engaging a number of different clinical undertakings, if you will, looking at real cases in real time with practitioners and specialists to address multiple issues. So I think you're going to get the information coming through a little bit quicker than you would in a standard drug trial.
I hope so.
And I certainly don't want to, jump all over your upcoming studies, but I know it's public information. Canopy Health Innovations has a companion animal division, and they just recently applied for some patents for particular strains for anxiety for both humans and animals.
I know that there are a lot of vets nowadays that are acceptable with it.
Yeah.
So.
Yeah, I had a question from a regulatory standpoint. This is specifically for Darcy, what do you see as the critical control points from a regulation standpoint in terms of getting from where we are today to getting a product to market?
Yeah, it's a big question. In Canada, CBD would have to fall off the controlled substances list. So there was some word that it might go from the cannabis category into the natural health product category, which would then be available for an over-the-counter product. So that'd be a big step. In the U.S., hemp seed actually isn't even approved as grass or generally recognized as safe. So even that by itself, even though you can buy hemp seed in a health food store, it's still not recognized as safe by the FDA or the industry as a rule, right? But there is a grass application in now with the FDA in the U.S., so hopefully that will shed some light and they'll have grass approval, right, which will really help. But hopefully CBD falls off the controlled substances list. That's the number one thing I think that would really move the industry forward.
Well, we know it's going to have to fall off if the Cannabis Act comes in, because you can't have a controlled substance being sold in the OTC market. Yeah. There was
My question is for Dr. Sandler. My little dog has to take prednisone for an autoimmune disease called Femigus. Is there anything that will replace a drug like prednisone coming soon?
On the cannabis side or alternatives to prednisone?
Cannabis side.
So we can talk offline. There's always alternatives, and I think Sarah can comment. Some prednisone alternatives are available. They may or may not work quite as well. On the cannabis side, again, I think when we look at the CBD side, we're looking at what are the anti-inflammatory processes of these particular products. If you're looking at seed only, if you're looking at stalk and bud, what is the terpene profile depending on which cannabis strain you may be using, and how that would particularly interact with an animal, for example. So how is that going to interact with a dog versus a cat versus a human? I think the thing that is really interesting to me is that when Health Canada licenses a medication, so for example, if your dog is on Medicam, for example, which is a very, very good non-steroidal anti-inflammatory, any of your flea or tick medications that you're now using, and sadly we're experiencing massive tick infestations in Canada, all of these medications are essentially tested from a safety and toxicity perspective on beagles, and then there's field trials on multiple different species or different animals. So the question I get all the time is, a Chihuahua going to react the same way to a drug that a Great Dane will? And for the most part, the answer is yes. Now, a small dog is not a small cat. Cats sort of sit in their own unique position, and horses do as well. And then food animals, we get into a whole other discussion. So the reality is some dogs will react differently to certain medications like prednisone, but I think you are going to see certainly CBD-based products to be used specifically around various inflammatory patterns. We know for certain GI diseases, so gut-based diseases in people, irritable bowel syndrome, inflammatory bowel disease, we see these products being used, and we know that there are large center studies that are starting to ramp up.
Hey guys, great panel. I love what you guys are doing. I'm sorry if this seems like I'm here for a free diagnosis, but so my beagle, he had lymphoma, and we went through all the chemotherapy and whatnot. He's done, but it seems that there is some relapse. But my question is CBD treatment as effective pre-chemotherapy versus post-chemotherapy?
I think you'll get different answers. Certainly, there's a lot of Facebook groups and things like Rick Simpson protocols, and those types of groups will say, no, get on board first, because the chemo is going to damage their body too much and they won't be able to respond as well. But I think there's also some studies coming out that treatment with CBD can actually go nicely hand in hand and may enhance the effect of chemotherapy in some situations. Again, it's really important to talk to the oncologist that you're working with, because some of the pathways that are required to break down and metabolize chemo drugs may be affected by CBD usage, so they're going to want to watch the dosing a little bit more. If you've sort of done the chemo and you say you're done with that, and now we just want to try CBD or a CBD-THC combination, again, I don't think that would necessarily be a bad thing. It's certainly likely to offer more hope than doing absolutely nothing, because we know the direction that doing absolutely nothing is going to go. But again, I just really encourage you to work with your veterinarian, or find a veterinarian that's maybe open to doing some of the research and the legwork for you and looking into that. Just be aware, and it's not just because your dog's a beagle, but you are a study at this point. Anyone who's choosing to use cannabis in your pets, you are our study population. So we want the feedback.
Thank you so much. This is really interactive. I love the fact that you guys are asking a lot of questions. Big round of applause for our panelists, please. And again, once again, thank you everybody for coming here for the Lift Expo. Don't leave just yet. We still